Hello everybody, I'm here with my good friend Dr.Koray Erdogan again, and today we are gonna talk about hair restoration in general. So I would like to ask first question, which is what do you think about hair restoration in general? Where we are heading?
I'm very happy to make this conversation with you, Bola.
Thank you.
We are old friends for many years, and he is one of the most known experts in hair restoration. Everybody knows him. Yeah, hair restoration is getting bigger and bigger.
Yeah.
And the number of patients are increasing every year. You know that in the beginning it was not so popular because of plagiar results, and people are talking and showing to each other, look who is operated, he did hair transplantation. But nowadays, mostly nobody understands that who is transplanted, who is not. Even the famous stars, they are operated. And so it's becoming more popular. So it was hair restoration, hair transplantation had a bad reputation in the beginning because of these very visible transplanted patients, but now nobody understands who is transplanted, who is not. Also, of course, there are many exceptions, but I think this growing. Every year it's growing.
Yeah, but also with popularity, you can see also many new problems for patients.
Yep.
I mean, people start thinking that it's an easy surgery, that if something goes wrong, they can fix it easily, but we know that is not true, especially for the donor area, and also if you do some mistake with angles and direction, then you can end even worse than.
I know you know much better than me because you have a chance to see many doctor results personally. Yeah, that's the problem now because you know Turkey is a capital city of hair transplantation in the world.
For sure.
And many people are coming to Turkey, and there are different levels of many clinics. So, of course, because of the inflation, everything is going. So people are trying to find the cheapest option. Sometimes this happens, and what they think that if I do the surgery and if I'm not happy, I pay nothing. So I go to another better doctor so I can fix the result, but. It's not working like that because you know from your forum you have thousands of patients, and I am also in this field for 22 years. I know many patients that we have only one donor area, and the golden standard in this operation is donor management. So if you lose your donor area with wrong tools, because this is what happens in the field. I see many depleted donor areas, patchy areas in the donor area. You cannot fix it anymore.
Yeah,
and another problem is the directions. Because you know, and I know very well, many patients are coming to it's a repair case to fix their problems in the first front line. And when you see the directions, sometimes you don't know what to do. So from the beginning, it will be much better to make a good research to find the right place.
Exactly, because sometimes people think it doesn't matter, they just need to grow, but angle and direction are extremely important because you need a natural result, which is the most important thing, I think, more than density.
More than density, yes, I agree with that. So when the competition is high, so people are to sell their facilities, people are doing some unscientific decisions. For example, Saphir FUE, DHI FUE. They are using this type of terminologies.
So maybe for our users and viewers, you can definitely explain what is DHI with not the new FUE, the new one.
No. DHI is, you know, DHI is a name of a clinic normally.
Yes,
it's
actually,
not a technique.
It was a name of the clinic.
Why they did it? Because DHI is a direct hair implantation. It's coming from that, and They were using implanter. Implanter is a device to replace the graft. There are many options. You can use forceps, you can use stick and place, you can use keep, you can use implanter. This is an option. And direct hair implantation technique, the clinic, the name of the clinic is a popular clinic. They use this name because in the beginning, they were extracting the follicle and without waiting outside, they are placing it so they don't have a chance to make premate incision. So that's the reason they were using implanter. And then they leave that technique anymore. Because why? If you do it at the same time, if you take the graft here and if you place it here, you cannot make a plan how you will use the singles in the first front line, how you will use the doubles in the second front line. So they quit that technique. But the name DHI now become as a technique in a wrong way because they are using implanter. And instead of saying that we are using implanter, many famous doctors are using that. The most famous one is Jose Lorenzo from Spain. He's an expert for implanter. So implanter is a very good technique, but there is no DHI FUE.
Exactly. It's not the new FUE.
Yeah.
Yeah, so this is something that patients need to understand. Some clinics try to sell you this new technique saying that is very good and very different from FUE, but it's still FUE. It's the same thing, just another name.
And sapphire FUE, for example. Sapphire is a type of blade.
Exactly.
For premate incisions to use it. You can use custom blade or sapphire. It's very well, but this is not another thing. This is not an FUE, another technique of hair transplantation. This is for premate incisions that you use sapphire blade. Is it good? Yes, it is good. You can use it. But I was using for a long time. Now I turn to custom blade again. So,
it doesn't change the
guarantee
result.
papers, for example, to give a guarantee paper to anybody is not ethical in medicine, in science. You cannot
because it's
guarantee.
cosmetic surgery.
It's
There is
cosmetic
no
surgery.
guarantee.
Of course, you will have some unhappy patients. Also, it's normal. The only thing that you have to do it, you have to take care of your patients who trust you and came from a long way. And of course, you have to take care of these people. These are important things.
Yeah. So let's talk about the workshop. I was
Yes.
here. I was here. It was a great event. Lot of friends and doctors that
I just want to thank you, and you came.
You're welcome.
And yeah, we have a lot of around 350 doctors from all around.
It's a lot of people. So what's your thoughts about that? You are happy? You think that it was successful?
I honestly, I was not expecting so many people.
Yeah.
I was shocked.
Neither do
when
I.
I think after 3 years after pandemic, doctors want to do some social event and they want to meet again. So I'm happy that they choose this destination for this. We show everything. Eyelash operation, SMP, and long hair, eyebrow, and all the techniques, machine and manual technique. 10 surgery in a day, and
it was huge.
They have a chance to see.
I have the opportunity to talk with some new doctor who came here, and they were very happy of what they learned about surgery and all this.
You know which location most doctors were here? Latin America.
Yeah. I met some Latin American friends here, and they're very, very happy. Long trip, but
it's not
worth it.
Yeah.
Well, I want to thank you for this talk. I hope we talk about interesting stuff for everybody. So.
And I want to announce something. It's a pretty new also for you. The next World Fue Institute workshop will be in Bangkok, I think.
Oh, wow.
It's also not an easy destination for many people.
I will be there.
Thank you. Thank you.
And thank you very much again. And thank you to all our viewers.